part 2 and last part of the our antibiotic topic. Okay, now let's begin. So basically we will talk about first the macrolides over here. So macrolides are also antibiotics and antibiotic group, and it can also be used for gram positive and gram negative. One thing is that this the macrolides drug, they in their name there will be throw every time, like for example azithromycin, clarithromycin, then roxithromycin, erythromycin, then telithromycin. Okay, and then like spiramycin, these all. Okay, so throw is coming in case of macrolides. Okay, macrolides will act on the 50s ribosome of the pathogen or bacteria. Then what will happen? Then the bacteria will not able to grow further and there will be problems. Okay, so now for example, what are the uses of the macrolides? Then it can be like used in case of rheumatic fever. Okay, and it can be used in like for example if the patient is having the penicillin allergy. So first in rheumatic fever we will prefer penicillin. Okay, but if patient is allergic to penicillin, then we're gonna use this macrolide. Okay, so another one is for whooping cough of. Okay, then another one is for like atypical pneumonia, then legionella, then chancroid. Okay, and then another one is this one like campylobacter. Okay, then and corynebacterium also. Okay, yeah, so continue. Then there will be what example is clarithromycin. The clarithromycin is a drug of choice for MAC infection, like mycobacterium avium complex infection. Okay, and for example if the patient has this infection, MAC infection, then we will give this clarithromycin with the ethambutol. Okay, we have to give with ethambutol. Okay, now another one is spiramycin. Then spiramycin is a drug of choice for toxoplasma in pregnancy, and the side effect of the macrolides are that it will lead to QT prolongation. We know that there is ECG, there is PU, there is P. There is P, then there is Q, then there is R, then there is S, and there is T. Okay, so this QT prolongation. Okay, this Q and T prolongation, it can lead to the QT prolongation, this macrolide as a side effect, hence it will cause problem. Then there can be like diarrhea also as a side effect. Why? So because what it will do, this macrolide, it will stimulate and there will be motilin stimulation. Okay, so that's why it will lead to diarrhea, but as a side effect, it is as a side effect, but because of this we can use this macrolide like in case of the gastroparesis or in case of the paralytic ileus. Like in gastroparesis, what exactly happened, that the patient stomach has become like the muscle has become kind of paralyzed. Okay, so the patient is feeling problem. So for like stimulating like diarrhea and all, we can use this macrolide in the gastroparesis because the macrolide side effect is causing the diarrhea. Okay, so due to what, motilin stimulation. Okay, so that's why we can use it in the gastroparesis and the paralytic ileus. Paralytic ileus is basically like the intestine is not working properly or not working at all after the operation. After the operation, post operatively. Okay, so that time for removing the blockage or for giving the patient relief from the blockage of the intestine, we're gonna use these macrolides. Okay, I hope you got it. Okay, then another one is this one used basically, for example topical clindamycin. Topical clindamycin are used for the treatment of acne. Acne are basically caused by the propionibacterium agents. Okay, propionibacterium agents are the bacteria which cause the acne. Okay, so we use this topical clindamycin, but there is one side effect that of this clindamycin, that can be pseudomembrane colitis. Then another group is the fluoroquinolone. Fluoroquinolone is a group of antibiotic. In their drug name there will be floxacin. It will do, it will inhibit the DNA gyrase, or we can say the topoisomerase 2. So hence we can use it in case of gram negative bacteria. So for example, suppose this is our gram negative bacteria and this is a DNA of this gram negative bacteria, and here is topoisomerase. Okay, so if there is topoisomerase and we have given the patient this fluoroquinolone, now the fluoroquinolone will act on this DNA gyrase or topoisomerase 2, it will inhibit it, and hence the DNA will break. Okay, hence the bacteria will not able to further continue. So that's how this is the fluoroquinolone action or mode of action. Now the use can be like as a mnemonic, we can remember the LMG, like for example levofloxacin, moxifloxacin, gamifloxacin. So basically they are also known as the respiratory quinolone. So as a mnemonic we can remember LMG, like levofloxacin, moxifloxacin, and the gamifloxacin. They are used in like also known as the respiratory quinolone. Why so? Because they act against the Klebsiella infection or the chlamydia infection or legionella infection. Okay, so that's why like we pronounce it like as a respiratory quinolones. Okay, then another one is ciprofloxacin. Ciprofloxacin, these are used in case of the pyelonephritis, prostatitis, and the prophylaxis of meningitis, and also like pfloxacin can also be used in case of prophylaxis of meningitis. Then in case of anthrax, then in case of traveler's diarrhea, if the person is a patient is traveling and having diarrhea, that time also. Okay, then for shigellosis, typhoid also we can use this ciprofloxacin. So as a mnemonic we can remember, for past we can use ciprofloxacin. For past means pyelonephritis, then prostatitis, then prevention of the or prophylaxis of the meningitis, then anthrax. Okay, then traveler's diarrhea, then shigellosis, and then the typhoid. Okay, for mnemonic we can use this past. Okay, then what is the side effect? Basically the side effect is of the fluoroquinolone, these are like cartilage damage. It will damage the cartilage, hence it is contraindicated in children also and in pregnancy also. So that's why. Okay, and one more thing, it can lead to tendinitis, especially in case of like old patient. Why so? No, not why so, I'm sorry. What is tendinitis? Tendinitis is basically like in our body there are tendons. So if there is inflammation, then that is tendinitis. I hope we know that itis, if there is any in any and there is itis, that is that means inflammation. Okay, now another one is, it's not hard, see, another one, it's another drug is nitrofurantoin. Okay, this is basically another like drug and belonging to the nitrofurantoins antibiotic, and basically they are also they are used in the urinary antiseptics. Okay, and so we can say we use it in case of treatment of UTIs. Okay, urinary tract infection. Then another antibiotic is the nitroimidazoles. Okay, nitroimidazoles, for example metronidazole. So these nidazole, okay, these nidazoles are coming in the drug name tinidazole. Then there will be like cetronidazole, metronidazole. So we can use in case of like parasitic infection, for example anti-amoeba. Then for example there will be like gardnerella or like giardiasis. Then what else, there will be certain side effect. For example there will be metallic taste. If the patient is on like nidazole, there will be like metallic taste. Metallic taste, patient will complain that the patient is feeling the metallic taste. Okay, so we can remember as a mnemonic like metronidazole and metallic taste, like this we can remember as a mnemonic. Okay, then it can also lead to disulfiram like reaction as a side effect, these nidazoles group of antibiotic. Okay, why so? Not why so, this disulfiram reaction is actually after the alcohol consumption. Okay, there can be tachycardia and there can be like palpitation and all these stuff. Okay, so the like nitroimidazole can also lead to such side effect. Okay, then last drug is rifampicin. We know rifampicin we use in case of like tuberculosis, or we use in case of leprosy. Then rifampicin is basically RNA polymerase inhibitor. Okay, then what are the side effect? Mainly the side effect often asked is exam also. The rifampicin can lead to reddish secretion. Okay, rifampicin can lead to what? Reddish secretion, R from R. And in case of purpura, like for example if the patient is having any purpura, okay, having any purpura disease, so what is happening, we should avoid this rifampicin in such patients. Why? Because if the patient is suffering from purpura, okay, and we have given by mistakenly the rifampicin, what will happen? The patient will develop a side effect known as the flu like symptoms. Okay, patient will feel like flu like symptoms. Okay, so we should be not given. Okay, it should better to avoid it and should not be given. Then another one, if the patient is taking OCPs, so it will not work. Okay, if you are giving rifampicin, it will not work. Why so? Because rifampicin will lead to the OCP failure. OCP are oral contraceptive pills to avoid the pregnancy. Okay, so basically, and it decrease effect also of OCPs. Also this rifampicin decrease effect of warfarin drug. Okay, And also this rifampicin affect like decrease the effect of the antiretroviral viral drugs also. So this chapter is finally finished.